So my name is Katrina McLeod. I'm a registered nurse and a registered midwife, and I work within the Mid North Coast Local Health District, currently acting as a nurse manager for early career development and education partnerships. So I guess my presentation today is to share with you a little bit about what it's like to be a student and to work within the Mid North Coast of New South Wales. So unfortunately, that slide hasn't come through properly. There's actually a picture missing, which has the map that says where we are located, but that's okay. Port Macquarie is part of our local health district, and then we stretch all the way up to just south of Coffs Harbour, and west to Kempsey. So we cover a footprint of the essentially the mid-north coast of New South Wales, and we're kind of that nice even midway point between Sydney and Brisbane. And across our sites and services, we have lots of different variety. So we have some larger hospitals where we offer things such as trauma care, intensive care, and lots of specialised, for example, cardiac services and cancer services. We have some smaller regional hospitals, and then also have some community-based and multi-purpose services. So, for example, Dorrigo is known as an MPS or a multi-purpose service, and there are a few of those located across New South Wales, and they're quite a unique mix where for us in Dorrigo, the site has an residential aged care facility, but also has an emergency department and a small acute care ward as well, and then offers some community health opportunities. We don't just have our hospitals, we also offer opportunities for nurses within the community health setting. So, working either in people's homes or in clinics, in mental health and alcohol and other drug services, and as I mentioned, in aged care as well. And so if this one will play, this is just a little bit of a snapshot of what it looks like to live and work on the Mid-North Coast.
From salt water to fresh water, we cover some ground. We make a difference to lives every day. We smile, hold hands. We have your back. There's opportunity to shine with a reputation for innovation, teaching, and research. We pride ourselves in our ability to care inside the hospital and out in the community. Then, at the end of the day, you can kick back in paradise. We know that makes a difference to you. The Mid-North Coast Local Health District. Why not make it yours?
So you can see in that video and also the pictures on the screen, we do live in a very picturesque part of the world, so we're very fortunate to be there. We work quite closely with a number of universities locally, Charles Sturt being one of them, and the benefit being that the Charles Sturt Port Macquarie campus is located not even a 5-minute walk to Port Macquarie Base Hospital, so very closely located. And for that reason, we take a number of students from the Charles Sturt Bachelor of Nursing course into our clinical facilities for those 800 hours of placement that Christina mentioned. So when we have students come into our setting, there is the opportunity to be placed and experience a multitude of different clinical areas. Depending on which subject you are studying at the time will depend on where you go for placement, but all of those clinical opportunities that I mentioned earlier are available for students to access. During the placements, we have staff who are employed specifically to support students whilst they're on placement. So they do things like do additional education, provide one-on-one support in gaining clinical skills, and also deliver in-services and training specifically for students as well. With Charles Sturt University, we have an opportunity where students can express their interest to be part of what's called a collaborative placement agreement. And that is where a student who is studying at Charles Sturt with their Bachelor of Nursing can be placed, for example, in Port Macquarie Base Hospital for the entirety of their degree. So you would then experience a number of different clinical areas within that one facility. So you become really familiar with the processes and the staff and the location, but still get that opportunity to have a breadth of exposure from your clinical ability. The other thing that we offer for students when they're studying is once you've completed the first year of a Bachelor of Nursing, it is considered equivalent to an assistant in nursing. So we employ students within our facilities in an assistant in nursing role where you have the opportunity to, in addition to your clinical placement requirements, have paid employment where you can work within the health setting, which a number of people report really help them consolidate their skills and develop their practice. Most of our AINs are employed on a casual basis, which means it can meet the needs of student visas and things like that in regards to work hours. Once students have completed, it looks like a number of my pictures are missing. You're missing some beautiful waterfalls and things on there, but that's okay. Um, once students have completed their training, we then have the opportunity as an employer for registered nurses to work within our services. So within New South Wales Health, there are a number of local health districts, of which we are one, and that encompasses the public health services. What happens within New South Wales Health is they annually run a recruitment campaign for graduate nurses called Grad Start. And that's how we recruit our graduate nurses. When final year students are applying for that graduate position, there's the opportunity to preference the different health services that people would like to work in. And so we acknowledge that people coming into the role will maybe need some support in transitioning from the role of student through to that of a registered nurse and becoming used to being that more autonomous practitioner. So we offer supportive pathways for our graduates where you can be rotated across different clinical areas. So maybe 6 months in, for example, a medical surgical ward, and then maybe 6 months in, say, a specialty ward or pediatrics or emergency or somewhere that might be of interest to you. And during that time, you have access to preceptors, educators who are dedicated for the graduates, and also additional study days and learning support to help with that transition. We then, within our graduate programs, offer ongoing employment. So within New South Wales Health, we can only offer employment that aligns with Australian work rights. So generally what we would do is our graduates are entitled to a permanent ongoing position. And when we have graduates who start with us who are on a temporary visa, if they are able to obtain ongoing work rights, once they've provided that evidence to us, then we can generally extend the contract for however long it is that the employee would like to stay with us. Opportunities for further career development into different pathways once people have done that graduate year and then are looking for their ongoing employment. So there's opportunities to move into different settings, move into higher level roles, undertake further study, whatever it is that's of interest to the person. And then there's the opportunity to be a part of special interest groups. So whether it's something that's related specifically to nursing, for example, we have like infection control champions, if that's something that people are passionate about, but also things that are not as directly related to nursing. For example, we have a lot of a focus on environmental sustainability currently. And so we have nurses who are champions who are part of that as well. Because we are a New South Wales Health public provider, we offer wages that are in line with the New South Wales Health or New South Wales Nurses Award. So you can freely Google that and you can see what people are paid as an hourly rate. And that increases each year that you are registered and working within New South Wales. Plus, then you're entitled to additional penalty rates for working things like after hours in the afternoons and the evenings, and then also working on the weekends as well. And then sometimes if you've gained additional qualifications or again are working in a higher level role, there's opportunities to increase that salary band quite quickly. That's pretty much us. That final page is just has my contact details on there and is just a little snapshot of some state awards that we've won in celebrating our new graduates and our nursing teams in some of our sites as well. We have a really close relationship with Charles Sturt University, and especially in Port Macquarie because of the location. Predominantly a significant number of our graduates come from the university. And because of that relationship, we know what the study's like, we know what the student placements are like, and then are able to kind of become that next level of support once people are employed. Thank you very much.